Good morning. My name is Amy Summers, and I'm here with Skylar Upton to talk to you about the WV VACS Initiative. So what is the WV VACS Initiative? It is the Vaccine Administration Collaboration and Support Initiative that was developed by Drs. Lisa Costello, Gina Baugh, Krista Capehart, Gretchen Garofoli, and Cynthia Priscilli. And this initiative was developed because we wanted to help volunteers across the state of West Virginia with the vaccine effort. So students from interprofessional education were going to be deployed across the state of West Virginia. And these students are made up of health profession students. And we wanted to reach out to all of the colleges and universities across West Virginia so we could reach all of the counties. So the first thing that had to happen was a partnership. So the initiative partnered with the West Virginia National Guard, the West Virginia Department of Health and Human Resources, and the West Virginia Higher Education Policy Commission. Once they formed their partnership, they decided that they needed funding. So they applied for a grant that was given to them by the West Virginia Higher Education Policy Commission. This allowed us to hire Skylar as the coordinator. It also gave us funding so that we could use a platform with WVNet. It also gave us the opportunity to give our students stipends. So when they traveled across counties, they could have gas money and food for lunch. And we also got some cool t-shirts for branding that said WV VACS to have our students wear in the clinics. So after we had that in place, a meeting was held across the universities and colleges in West Virginia to identify points of contacts and programs that were interested in helping with this initiative. Once those point of contacts got back to our coordinator, she developed a survey and sent it out to the students to gather data points such as email, contact information, and what counties they would be willing to be deployed in. Skylar received over 1,000 responses from the survey, which was pretty impressive. Once we had the interest, we met with our VACS team to develop coursework. So the courses that were being developed were for a couple of reasons. First, we wanted our students to be on the same page with messaging and with all of their clinical practices, as well as giving them an added insurance coverage while they were out in the clinics. So we met with our team and we had materials that they wanted to have loaded. And the materials came from the CDC, which gave us information about each one of the vaccines. Also, it gave us our PPE, personal protective equipment, so the students would make sure that they handled all of that in the appropriate way. Also, they had continuing education classes for the vaccinators. And the vaccinators were vaccinators because it was within their scope and their programs. We did not actually teach them to be vaccinators. And we also had to have them register with WV Ready so they could be registered across the state as volunteers. So once we met with them, that was the first thing on our timeline. We got that established. We then met with WVNet, who gave us a crash course on how to use Blackboard and how to do our coursework and upload everything. So then we took the next week and Skylar and I uploaded the vaccinator and support staff courses and we built them in Blackboard. And then the next week, over 800 students were enrolled for both courses. And in March, we had 6 counties that were piloted. And the first week, we had 33 students who went through the complete program and were deployed to assist the community clinics. And I'll turn it over to Skylar.
Thank you, Amy, and hello, everyone. I'm going to start out with the 4 platforms that we use to help develop and enhance our online course. Qualtrics XM was the survey platform used to create all of our surveys throughout our process with our students and staff. As someone who did not have a previous experience using integrated surveys, this platform was very user-friendly and required a small learning curve to create the type of surveys needed. Additionally, this platform held an advantage by allowing us to distribute and collect data from a large number of recipients. This was essential, as Amy previously mentioned, our initial student interest survey had over 1,000 responses in less than 1 week. The interest survey collected information on the student's discipline, education level, training, availability, counties of interest, and so on. The information collected from the interest survey allowed us to know which students would be volunteering as vaccinators or support staff. Once the students' information was verified by their program representative, Excel was used to separate these students into vaccinator or support staff groupings with their corresponding information. In addition to the many benefits Excel has, we were also able to create usernames and passwords for over 800 students. This was vital as we were on a tight time restraint and allowed me to mass email students with the course link and general instruction on what their log information would be. This was rather than sending each student what their randomized unique password would be, which is what many other programs would give you when looking for a system. After the students were organized in Excel, they were ready to be registered for the Blackboard course. Through creating our 2 course sections, we found that having our learning materials such as links, modules, and other information to be organized into separate content folders rather than in a learning module format to be more user-friendly for us and the students. Additionally, by creating membership groups of students who completed all requirements and those who had yet to, we were able to restrict access to certain folders. By setting membership restrictions on certain course material to only allow those that had completed all requirements, it allowed us to ensure that only those students were able to view our volunteer sign-up link. And so after looking for a platform to house our sign-up link that would allow us to connect both course sections seamlessly, we found Sign-Up Genius to be the best option. Our students were able to self-select the volunteerships that worked with their schedule rather than being assigned to one. By having one sign-up connected to both course sections, it allowed our vaccinator students to also volunteer with support staff job roles. I was able to easily embed the volunteer sign-up link on Blackboard so it was constantly updated with our new sign-ups. We were also able to connect multiple sign-ups to include past clinics for easier student access when they were reviewing their past volunteer experience. Sorry, 1 second. Through the use of these programs in the Blackboard platform, we were able to launch our online courses for students wanting to help with the community clinics. More than 880 students were registered and enrolled over both courses. Our student participation is displayed in the graph below and shows that from the support staff course, about 40% of students completed all requirements and around 50% had at least accessed the course. From the vaccinator course, 20% of all students completed the necessary requirements and more than 40% had at least accessed our course. The West Virginia VACS Initiative was able to provide support to 70 clinics, of which our students completed more than 900 hours of general volunteer service. We have learned a lot over the past 4 months and would like to share some of the common barriers we faced and what our solutions were. While some students may have used a platform similar to Blackboard previously or with their home institutions, for many this was new and they struggled with course navigation initially. To better combat this, I did a video recording that started from their registration email and explained how to access the course, the folders to start in on Blackboard, and submission box instructions, and so on. This was sent to all students via email as well as uploaded onto Blackboard. It would have been beneficial to have a video such as this included with our initial student communications. After receiving emails from students of both courses asking what learning material needed to be completed prior to volunteering, we included a more detailed list of instructions. For example, all students had to register as a West Virginia volunteer with West Virginia Ready and submit confirmation. To help simplify this, we included the link and step-by-step instructions for students for filling out their registration and included a detailed description of what was to be uploaded. In addition, students in the vaccinator course were required to complete 6 continuing educations from the Centers of Disease Control, which centered around better vaccine practices. We included all necessary links for the students to complete these modules and instructions on how to receive a certificate of completion, which was to then be uploaded onto Blackboard. All 6 of the required continuing educations were placed into separate content folders for navigation for easier student navigation. While having the directions listed for students on Blackboard was helpful, it may have been in our favor to have uploaded a screen recording showing the process of leaving the Blackboard site and entering a third-party platform to complete these requirements, as well as returning to the Blackboard platform to submit their requirements. When the West Virginia VACS Initiative first launched, the clinic requests we were receiving were for weekdays, in which they wanted volunteers for 8-hour shifts. This conflicted with many students' school schedules, and so we worked with the clinics to allow for 2 volunteer shifts, a morning and afternoon. From this, we saw an increase in volunteering and believe our numbers would have been higher if given this option from the start, or if there had been more weekend clinics. For example, in 9 weeks, we received 11 clinics requesting support on the weekends, of which we were able to provide student support to 10 clinics. We often received clinic requests with less than a week's notice, which made it difficult for our students to plan in advance with their busy academic schedules. While this late notice was to no one's fault, as everything at that time with COVID-19 was very fluid and ever-changing. To try and combat this, however, emails and Blackboard announcements were pushed out notifying students that we had received the clinic request for the week and the sign-up would be available soon. This allowed students to look at their school schedules and personal schedules to see what they were available for. They would be ready when the sign-up link was live. We also communicated the possible tentative counties that would be requesting support in the coming weeks, so that students who were wishing to support in certain areas would be aware. I will now pass it back to Amy to go over our future implications.
Thank you, Skylar. So going forward, now that we've gone through the pandemic and the need for the large vaccination clinics has kind of subsided and gone back to the pharmacies and CVS and Walgreens, we are looking towards uploading COVID-19 testing training to this platform. The nice thing about working with WVNet and using the Blackboard platform is it's already there. We know how to use it, and the training courses that will be needed over the next several months can easily be applied with the 800 students that are still within the enrollment. So I believe today Skylar will be going to a training to obtain those materials to have that uploaded for our students in the event that they might be needed for return to campus and testing the college students. In the early days, we used a lot of volunteers from the hospital, and I'm not sure we're going to have that. We're not going to have those volunteers going forward. Excuse me. We must have a predator outside. Sorry about that. Also, yes, we do. We have someone dared to walk in front of our house. I'm so sorry. Also, this initiative can be used to deploy boosters in the event that they think that those will be necessary. So the Blackboard platform has been very easy to use, at least for Skylar and myself, and with the lessons learned going forward, we'll be able to help the students become more efficient with their training and launch. So thank you very much. And